Hi, I'm Dr. Myrna Lazaga here in San Diego, California. We get a lot of questions regarding tooth extractions. So today we're going to answer most common questions that we receive to help you better understand tooth extractions. Dental extraction is pretty much taking out a tooth um, from the mouth of a person. There are many reasons that the tooth need to be taken out or extracted. One, if the tooth has decayed on the roots, that means that the tooth is not savable anymore. And if there is also where you have wisdom teeth that is impacted, or if you have some cracked tooth that involves the roots as well. Or another thing is when the tooth is really loose, like mobile, and because of due to bone loss. There are two types of tooth extractions. One is the regular, we call it. That means that the tooth is loose, also there's not much bone left, so it's easy to take it out. The other one is what we call surgical extraction, where we have to dig in there. Sometimes we even have to cut your gums in order for us to facilitate to get that tooth out. I will recommend that your wisdom has to be taken out when you're younger, like below 21 years old. And if you don't have room for your wisdom, the reason behind is when you're past 21 years old, the area of the bone gets more denser, and then it's easier as well to take it out when the roots of the wisdom is not fully formed, so less complication. Usually, in that case, rarely we do not recommend tooth extraction just because you need braces or you don't have room or because you have smaller jaw where it does not fit all the teeth you have. In my office, most of the time when I do braces, I try to expand the jaw as opposed to taking out teeth just to fit in because you have severe crowding. That's the reason why, as well, I end up starting to offer braces or orthodontics at the office. If a child has severe decay on a baby teeth, that's the only time I would recommend to have that tooth extracted. But as much as we can feel it, we can save the baby teeth, I would rather do that because baby teeth serves as a space maintainer that hold up the space for the grown-up teeth to come out. Once you remove the baby tooth, it takes a while for the grown-up teeth to come out or to erupt. And also that causes more crowding because you lose more space when the baby teeth is out. When you have gum disease and it's already advanced and you don't have any bone support for your teeth, pretty much your teeth are wiggly. And that's cannot be saved anymore, which in my case, I have that experience before. A lady, 23-year-old, I have to extract all her 32 teeth because of gum disease. There was nothing bone left to support her teeth. I told myself I would hate to see this on my patient when they have gum disease. The simple tooth removal, it does not make the tooth is easy to remove. It's already have like what we call 2+ mobility that's really loose, and we really don't have to dig in. The surgical extraction, we have to sometimes cut the gums to dig in there and also remove some bone to facilitate the extraction of the tooth. The best way is to see a dentist because most dentists can do tooth extractions. The normal tooth extraction, it should only take 15-20 minutes. But if it's surgical, might be 30 to 45 minutes. It depends on your case scenario. If there are some infection there, that's the reason why you have that tooth extracted. We may have to clean that area first before we put an implant there. So it has to be evaluated by your dentist. Some offices, especially oral surgeon, they can do that. They can sedate you or give you IV to put you to sleep. After a tooth extraction, you would try to avoid that area. Any area when you have tooth extraction, avoid that area of disturbing it, like toothbrushing. Stay away from that area. Normally, we give you instructions after we do tooth extractions at the office. One is you make sure that you don't rinse. Two is stay away from food that are spicy and temperature hot. And also avoid using a straw so you don't create any suction or pressure in that area. And then also avoid any strenuous activity as well. Avoid rinsing after you have tooth extraction in order to not to dislodge the blood clot. The blood clot helps in the healing process. Once the blood clot, by rinsing or sucking on a straw, dislodges, you end up with what we call dry socket, which is more painful than the first pain when you have the tooth in there. So make sure you follow that instruction. And also, smoking also does that. The nicotine also irritate the blood clot. Dry socket is the one that I mentioned when the blood clot is dislodges. To avoid that is first, like I said, smoking. Stop smoking for 48 hours. Avoid strenuous activity for 72 hours. Avoid eating spicy food. Avoid also food that's temperature hot. Room temperature is good. And avoid rinsing hard. I would recommend to wait 72 hours before you do exercises. But normal walking, but as long as it's not strenuous one, you can do that. Usually it takes 2 weeks for the area to heal, but you have to keep that area clean. The sooner the better, so you should call the office to set up an appointment for tooth extractions. I hope I answered all your questions, and if you do have more questions, please do not hesitate to call our office and set up an appointment at 619-477-0570. We're here to help you.